Hello, and welcome to Gun Violence in Missouri, Seeking Solutions, presented by the Kansas City Star in partnership with American Public Square at Jewell. My name is Denisha Snell. I'm the Director of Programs for American Public Square. In the past few months, Kansas City Star reporters have interviewed citizens, activists, faith leaders, and survivors of gun violence as part of their Gun Violence in Missouri project. This project was undertaken in partnership with the nonprofits Report for America and Missouri Foundation for Health. Eating healthy, getting regular medical checkups, exercising, and sleeping sufficiently are all behaviors well known to influence health quality. However, studies suggest one unexpected factor that can predict the health of a community: education. Education gives people the tools they need to lead fulfilling lives, thrive personally, and contribute to their communities. Today, we've assembled a group of panelists who are dedicated to improving outcomes for Missourians by advocating for students and better school funding. Communities who have access to quality education throughout their lives tend to stay healthier than people who don't. Not only does education give individuals a chance at upward mobility, which places them in better financial circumstances to access quality health care, quality housing, and better food options, it also puts them at lower risk of perpetrating or experiencing gun violence. The goal of today's event is to engage community members and work together to understand long-term solutions to reducing violent crime through the lens of the social determinants of health. We will have a civil fact-based conversation exploring how we can move Missouri forward. As part of American Public Square and Kansas City Star programming, we welcome questions and fact checks from the audience. Please comment on the live stream with your questions or requested fact checks. Ian Cummings, editor with the Kansas City Star, will serve as today's fact checker. You can also find a fact sheet to support today's conversation on our website, americanpublicsquare.org. With that, I will turn it over to our moderator, Hurubie Meko, reporter for the Kansas City Star. Hurubie.
Thank you, Denisha. Through the Missouri Gun Violence Project, the Star is taking a novel approach to examining gun violence by exploring its many forms, understanding root causes, and identifying effective solutions. Our latest series exploring how gun violence is impacted by and impacts the community's social determinants of health. Those quality of life conditions include having stable and secure housing, accessing good food, attending quality schools, and growing up in racially segregated or economically depressed neighborhoods, what researchers call the social determinants of health. Today, we are closing the series exploring these social determinants of health by examining schools and school funding and how this affects gun violence in communities. A Star analysis of 20 years worth of school finance data found districts grappling with the highest rates of gun violence often received less funding, less financial support from the state compared to other schools. On average, Missouri funds about 32% of school budgets, but funds only around 8% of St. Louis City School District budget and 3% of the Kansas City public schools. Education has been described as the most important modifiable social determinant of health and has shown to increase healthy behaviors and improve health outcomes across the lifespan. To begin our discussion today, I'd like to introduce our panelists. Please welcome Samantha Sherman, Prevention Resource Center Director at the Community Partnership of the Ozarks. Next, we have Darren Seals. Darren is the president of Sankofa Unity Center, an anti-violence organization in St. Louis. Darren has worked with Circuit Attorney Kim Gardner on a diversion program for youth and does a lot of mentorship work in the community. Finally, we are joined by John Myers. John is an education policy consultant and a fellow with the National Education Policy Center. Thank you, panelists, for joining us today. We are examining the gun violence issue that plagues Missouri and how education and educational funding play a part in the health of our community. I want to start by giving each of you the opportunity to tell us more about yourself and your work in education. Let's start with you, Samantha.
So working in the prevention field, we have a 21 county service region that we serve at Community Partnership of the Ozarks. And in that, we work to provide support in regards to suicide prevention education through various trainings to the schools in our region. So while this conversation is really focused on firearm violence prevention, suicide prevention education fits right in with that because suicide makes up 55% of all firearm deaths in Missouri. So that's kind of where my focus lies in regards to education and this topic today.
Thank you. Next, Darren, if you could tell us a bit about yourself and your work.
How you all doing today? My name is Darren Seals. I run an organization that focuses on changing the mindset of our youth. What made me get involved in this work is I started seeing that I was failing when I was growing up, and I tried to be part of the solution and not the problem. I noticed that when I was in high school, I went to the street life afterwards because there was nothing to do in my neighborhood. Wasn't no resources for me, and I think I got surrounded by a lot of guys that pulled me into a life that I wish I would have never went. And I just started mentoring all the kids over St. Louis, being part of the solution.
Thank you, Darren. And John, if you would tell us a bit about yourself and your work. I believe you might be muted.
Of course. My work has been about school finance, equity, and adequacy, and it spans really decades. But the most important thing for today is the fact that I work for the Missouri Education Coalition for Adequacy and an organization called the Committee for Educational Equality. Those were really about a decade ago. And what we tried to do was create a new, adequate, and more equitable school finance formula. And I've worked all over the states, but recently I have been working with the National Education Policy Center, which is at the University of Colorado, and we're looking at the cost of opportunity. In other words, what's the funding needed in order to get all kids to achieve at very high levels?
Okay, thank you. Throughout this series, we have talked about disinvestment in certain neighborhoods in both Kansas City and St. Louis. This disinvestment has affected housing, access to quality food, and even the built environment of certain communities. Let's talk about how this disinvestment affects educational funding. Let's start with you, John.
Well, it's clear that that the question on how schools are funded goes to the issue of the General Assembly is required to provide that equitable and adequate school finance formula. And what we know is that in Missouri, that it just hasn't happened. Your state constitution requires 25% of the state revenues to go to public education. But the work we've done has recognized that that's doesn't make a difference in the total amounts that are available to achieve equity and adequacy.
Okay. And Darren, you're the boots on the ground in the community. What have you seen? You're muted.
Sorry about that. What I've been seeing is a revolving door, a cycle that, let's say, for instance, like I went to Northwest High School, and then I got bussed out to Oakville Senior High Schools in the suburbs. And it was a better life out there that I could have chose, but in a city, you got to have the funding to put like different resources. So I think it's very important to make sure the kids have something to do. And it's a revolving door. I see kids searching and they searching, but it's just a revolving door. And sometimes the system got to stop and somebody got to change the system. So if it's like, why is it taking so long to change this? How many kids we got to lose for someone to change one process,
Thank you, Darren. And Samantha, we hear often about disinvestment in urban areas, though we know our rural Missouri communities also struggle with lack of resources. Could you talk to us about what you have seen in your area?
Yeah, many of the rural communities we work with do have a huge lack of resources. We can go in and give as much education as possible in regards to, how to reach out to youth and how to recognize if they're experiencing things like suicidal thoughts. And a large part of that education is teaching adults how to properly refer youth to services. But in rural communities, more often than not, professional help is really lacking. So even when youth are receiving the help and support they need from the adults in their lives, if they're experiencing a crisis like suicidal thoughts, they really need that professional help as well. And sometimes in rural communities, that can be a waiting list for many weeks and even months.
So as you just mentioned, Samantha, one issue that was mentioned in the story looking at school funding and gun violence was also the lack of resources available for counseling and trauma-informed training in schools. So Darren and Samantha, if you could tackle that a little bit, and can you explain how important these kinds of services are for students who come from communities struggling with gun violence? And if we could start with you, Darren.
Okay, it's when you got a kid that's at nighttime, they see their best friend murdered, and then the mother asks them to go to school. See, the reason I can speak on it because I've been shot 13 times. I was one of them kids that watched death ever since I was 11 years old. But then I would go to school not knowing that I was traumatized. So the counselors and nurses, they didn't know how to understand or relate to me. So now, since I'm doing the work, I try to tell people you got to go inside the home. You know, no matter how much you make the school right, you got to go inside the home to make sure the home right. So I see it every day, kids searching for a way out. They don't know how to get out. You know, like, how do you go to a counselor and ask for help to a counselor to a school, and she won't even come to your home? You know, so it's like I see the kids trapped in a bubble and searching their way out.
Thank you, Darren. And Samantha.
In one of the trainings that we do that revolves around teaching individuals about mental health crisis situations, we send a monthly survey to participants to hear how many youth they've referred to some type of mental health service that month. And we've been tracking this data since 2015. And since 2015, over 20,000 youth have been referred by this group of individuals that have gone through our training to some type of professional help support or other support within our area. And that's only Greene County youth alone. And for those of you that aren't as familiar with counties, that's the Springfield and surrounding area. So over 20,000 youth just in that area alone have been referred to a service. So that really does show how much of a need there is for adults to know how to help students in regards to suicide prevention and gun violence and this topic that we're talking about. And it also shows that there's a need for counseling resources because many youth in our communities really do need that additional support.
Okay. Thank you both for explaining that need a bit more. And now that we understand several of the issues the communities are facing, let's talk about how schools are funded. And John, you started explaining this a little bit, but on just the most basic levels, how are schools funded? And you're muted once again.
Most of the money comes from both state and local funds. And it is the State General Assembly that has the responsibility for determining how much that is. And so the goal here is to try to look for adequacy and equity. 10% of the money comes from the federal government. That money is primarily for special education students and Title I, which is to assist with some of the classrooms of economically disadvantaged kids. But what we know is that we, on the funding side, there are two equities to be concerned with. There is the taxpayer equity. That means the wealth of one school district shouldn't control how much is spent in that district, and that there ought to be equity as it relates to the taxation in the state, and that the wealthiest districts shouldn't receive more money than poor districts. There's also student equity, and we'll talk more about that in a minute. But that's what that's what this program is more about: is how to get more program and services to those students who need it the most.
Okay, so are all Missouri schools funded the same?
No, and they shouldn't be. As I mentioned, that this is where we start talking about student equity. Some school districts have very high need students. And in most states, there's an adjustment in their formulas for special education students, English language learners, economically needed students. In Missouri specifically, it's a count of free and reduced lunch that provides the extra amount of money into the school funding formula. But all three of those are less than what we find in adequacy studies. So Missouri is far behind on funding the special needs of special students. Additionally, I would mention that school boards play a role, but again, they are limited by the school funding formula from the state General Assembly.
Okay. So I know you mentioned this a little bit, but would you say that Missouri schools have enough funding?
No, clearly not. I mean, in fact, recently I've seen articles that said Missouri was 49th in the country in how they fund their public education. Now, I don't know about that, but I do know a decade ago when we were looking at school finance adequacy in Missouri, it would have required additional $1 billion in order to get to that basic adequacy level. And that level is nowhere near the level that would be accomplished by identifying public education as the great equalizer. In other words, that all kids can achieve at high levels. That adequacy was based upon just getting all kids up to proficiency, notwithstanding addressing the needs of others.
Okay, thank you for explaining all of that, John. Darren, how have you seen the lack of funding manifest in community violence?
Violence on a high rise. Just my opinion. School's supposed to be a safe haven, you know. So when you go to school and you try to get away from everything that you see at home, it's I think they should put more money toward trauma into the schools. That's my main thing. Every little kid I see, they traumatized, or some little girls don't want to go home because the uncle getting raped. The uncle is raping her, or somebody is doing some foul like that in the household. So school supposed to be a safe haven. So the funding, they got to put more funding into the schools, because we're gonna be at the same cycle 20 years from now. You know, so how do you stop it? You got to stop it. It's not up to me. I don't think it's that hard, where you look inside the household and see what's wrong with this kid. I always say, like, jail and school supposed to be rehabilitation for you to get older to make right decisions. And all the kids now, they're making all the wrong decisions. You got to figure out why. Something is lacking.
Okay, thank you, Darren. And Samantha, how has the funding or lack thereof affected schools in your area? And does this affect the type of resources available to students?
Yeah, oftentimes we see school districts only have one school counselor for the entire school district. So they not only have to assist in things like school scheduling and applying for college scholarships and things like that, but they also need to provide things like mental health support and crisis support for students that are going through some of the things that we're talking about here today. And one person can only do so much. So there has to be something lacking when there's all of that needs to be addressed, and there's only one person that can really be doing those things. So with all that, students are not able to receive the true support that they really need, even when schools really truly are doing everything they possibly can, but only with the resources that they have, which are clearly lacking.
Okay, thank you. From a public health perspective, we know that education is a key social determinant of health, a major factor in economic stability, chronic disease prevention, and even life expectancy. Yet, for many children, a quality education is nearly impossible to achieve. Let's talk quickly about the policy around this and efforts. John, we know that some policy works well for some students and not so well for others. What policy is working well when it comes to the policy and school funding?
I would mention two things. First of all, community schools, the concept behind the community making choices about what's most important and how to engage other community organizations with schools. Schools can't be the great equalizer without healthcare, without food services, without being a part of the community school. So that's one thing. Secondarily, the National Center for Education Policy work that has begun really identifies the fact that you need healthcare providers, you need psychologists, and various services at the school level. And we see there is insufficient of those currently.
Okay, thank you. Samantha, policy is good, but action on the local level is as important. What type of suicide violence prevention happens in schools in your area?
There is really a lot of suicide prevention and violence prevention occurring in schools in our area and across the state of Missouri. One of the big things is a training called Youth Mental Health First Aid. And this is where adults learn how to recognize if a youth is struggling with some type of mental health challenge or crisis, and then how to properly intervene. So it's kind of similar to CPR, but for mental health. There's also Teen Mental Health First Aid, which is a newer curriculum, and that is where students are learning how to help their peers, and mental health and suicide crisis situations are addressed, as well as violence prevention is addressed briefly in that curriculum as well. And there's an emphasis on getting a trusted adult involved in that training. And then lastly, one of the big trainings that's been occurring across the state for many years is called Signs of Suicide. And this is where key staff in the schools train other school staff and also parents how to recognize if a student is having thoughts of suicide and then how to help them. And then from there, they also provide a training within the classrooms for students to know how to help their peers in a suicidal crisis as well. Okay. And that's honestly just a brief overview. There's a lot of other things going on.
Okay. Darren, if you could also just tell me a little bit about what kinds of violence prevention efforts are happening in schools or in the community in your area.
Well, in the community, we have different organizations. They come in like Cure Violence, Life Outside of Violence. But inside the schools, when I was going into the schools before COVID hit, I really didn't see too many, prevention. They have different folks come in and speak, but you have different organizations that help on the outside, but not on the inside.
Okay. So are there ways that these programs could be better supported, or the creation of these programs could be better supported?
I mean, yeah, if the money was there, folks can come in and probably, only to me in the city schools, I always tell people, only people that's going to fix the streets or this mess is the ones that messed it up. So you have to go and try to see if you can find different folks. Everybody else has a PhD or something behind their name. Like I got a PhD in mistakes. So the average kid, I can teach them not to make this mistake. You know what I'm saying? So if you have the right folks and the money, you can change the school system around.
Okay. And Samantha, you mentioned some programs in your area, but are there ways that they could be better supported? Is there something that the state should be responsible for? Or is that something?
So actually, there is this thing called the Missouri Suicide Prevention Network, and they have a school committee. And this is a newer group, but I know that that's something that they're really focusing on. It has people from all over the state of Missouri that are kind of key workers within this, from behavioral health agencies, from the schools, from DESE and other state organizations as well, that can help really make some big changes. So yes, I think that there needs to be something happening statewide and from the state, and I think we're moving in that direction, hopefully.
Okay, thank you both. Darren, what are your thoughts on what should be done to improve educational outcomes? And do you see this as a citywide effort, local effort?
It's both all the way around the board. I think they need to put, if you have, like she said, they have suicide organizations. I didn't get the name of it, but she said they have this program going deep out somewhere in the county. But what about the city schools? I never heard of anyone talking about suicide. I've been in the schools for like 3 years. So I think they need to bring that program and put it down in the city. It should be another branch of it to how do you get the gun violence? It's the same thing, not coming from another conflicted upon themselves. But when you go to school, you might get killed going home from school through somebody else. So we got to have some kind of, they got to have some kind of arrangement after school activity where the kids can bring the school back to a safe haven. You know, really what I'm trying to say, make it safe for a kid again. You know, so like it was different from the city schools and when I went to Oakville. But none since I was going to school, I never had a counselor ask me was I'm okay. So the counselors need to get a new role of what they got to do for us. Like I have never seen the counselor come to my house. I walked right past a body going to school, and they knew it because I slipped and fell right beside the body, and nobody came to me and said, "Are you okay? Are you traumatized?" So we didn't. In the city schools, they don't get that. So I think they need to bring the funding to programs like that, so the kids won't be traumatized.
Okay. Samantha, I know you mentioned the statewide suicide prevention network, and Darren was saying that would be something great as a member of St. Louis City if they could tap into that. Are there any efforts to bridge programs like this between urban and rural communities?
Yes, I believe so. I think that the plan is for this to be a statewide effort, and it's not just for a specific county or a specific community, but it should be available statewide. And I do believe that there should be some different prevention resource centers, which is what I work in here in Springfield, in Darren's area that he lives, that should be able to provide very similar resources and trainings that I've been discussing here today. So I'm hopeful that that will start expanding and be more well known for the schools in that area.
Okay, thank you both. So as we move to a close, we want to spend our last few minutes discussing the immediate steps that can be taken to address the school funding crisis by those watching. As it is tradition with all of our programs, we want to give each of our panelists the opportunity to answer the questions, so what and now what? What should we do first to move our communities in the right direction? And let's start with you, John. So what, now what?
Well, so what is that you're in a hole and you got to get out of it. And from an education funding standpoint, the only way to do that is to address state policy. And state policy, so the governor and the members of the General Assembly are the ones that on a regular basis decide how much money is going to be available for public schools and which public schools get that.
Okay, thank you. And Samantha?
Well, keep in mind that in regards to a student experiencing suicidal ideation, recovery is possible, and there's a lot of things that adults can do to help reduce the risk that a young person they care about might be engaging in attempting suicide. And so there's a wide range of things that we can be doing pretty right off the bat after this conversation. One of them can be attend a training. Like I mentioned, those youth mental health first aid trainings should be available statewide. So get connected and just search that on Google and see what's available in your area. Lock up the firearms in your household, especially if a family member or friend is at risk for suicide. That's one very simple way to reduce the risk of any type of firearm violence going on in your home. And also recognize that people who have thoughts of suicide are having those thoughts because they do not want to keep feeling the way that they're feeling. So don't be afraid to check in on the students in your life and individuals in your life in general. And keep in mind that everyone can play a part in helping reduce these tragedies.
Okay, thank you, Samantha. And Darren, so what, now what?
So what is, we have to change the system. That's going to be one of my main topics I always say. Like John said, how do you get out of the hole? Certain folks that actually make the rules of who can come into the schools got to understand what school you're going into. And how do you do it? Like some schools don't have these problems. Like some city schools don't have these problems. But then the schools that has a problem, let's take a counselor. You got one counselor, 200-300 kids. There's no way she can handle that caseload. So put more counselors in the school, change the roles of the counselors, or hire some more folks that can go to the home front to see if we can change the home front. Put life skills into the schools. All the city schools, they took out cooking, Wood Tech. I ain't seen that in the city school in years. Bring that back to get the kids prepared for their adult life. They say Missouri is behind in money. I would wonder, like, why? I'm gonna say this again: school's supposed to be a safe haven. The average kid, when we was growing up, we looked at love, Love. These little kids look at love as Time. You know, how many adults, how many teachers just teaching? You know, it's a lot that I go on, but we got to bring the mental health, trauma, the whole 9 yards to change the kid. And if we don't reach that kid, we got to keep on reaching them. So just got to keep trying.
Okay. Thank you, Darren. So we do have an audience question. The question is, what solutions are in place now for the urban community? What safe places have been created? So Darren, if you could answer that for us.
Well, right now in the communities, they have different organizations that's doing a good job. You know, when I say good job, because I'm out there with them, trying their best to change the normal. You know, like, why is it that we in the city, you know, I'm only speaking for the city of St. Louis, inside the city, you got kids that's actually watching video games, that's actually going out being these videos and thinking it's a reset button. So you got, you know, Sam Martinez, Employment Connection. He hired a lot of kids off the street, cure violence, life outside of violence, different organizations that's helping. We need more organizations like that in St. Louis. You know, so the higher folks, I would say the higher folks that can make this happen need to bring in more organizations and just be inside the schools more often.
Okay, thank you. So we do have a couple more minutes. If there's anything we've missed or anything that any of you believe is really important to mention, I can give you the floor for that.
I can jump in there if nobody's saying that. The kids I have mentored and been around, they want out. They want out. But a lot of kids, the average Black kid, you know, you probably look at death at 25 to 30 because of the choices that person made. Now these kids is 15, 13, and 14 carrying semi-automatics. So you have to change the system to get them prepared for later on. And I think that all of us I always tell everybody it's our fault. You know, just like the folks ahead of us, it was their fault. And the folks before them, it was their fault. So why is this steady at our plate? We have to change the system. You know, how can we get the next Martin Luther King, the next Malcolm X, or the next leader, and he's dying at the age of 13? So you got to figure out trauma. Why is these kids killing? And I know it's going on in every state across America. So I see it so much. I'm just really trying to do my part to clean up what I messed up.
Okay. Thank you, Darren. And John, if you have anything you would like to add or respond to anything that Darren had said as well.
Well, it's a little easier to talk about, you know, the governance and oversight than it is to be at the level where Darren is, and that's what makes this difficult, is because you have over 500 school districts in Missouri. You'd be better off if you had fewer school districts. But historically, we've created this school funding pattern and this school governance pattern that in many ways has become fairly antiquated. And the only way to address it is significantly getting into reforms.
Okay, thank you. And so as we near the end of our panel discussion today, I guess we're not exactly nearly out of time, but this has been a lively and insightful discussion. So I just want to thank all of you for your participation and giving us the time today. I'd also like to thank American Public Jewell and the Kansas City Star for facilitating this important discussion and allowing me to serve as today's moderator. Discussions like this help connect our reporting to the community. I would also like to thank Report for America and the Missouri Foundation for Health for supporting these important efforts. The Kansas City Star will continue to investigate the causes, consequences, and possible solutions to the gun violence problem in Missouri. If you want to support the STAR's in-depth reporting and solutions-focused community engagement efforts, please visit kansascity.com/MissouriGuns. Finally, if you enjoyed this program and believe that conversations like this are important, please consider becoming a member of American Public Square. APS members help support programs and allow the organization to continue providing a space for civil, fact-based discussion. You can learn more about membership and its benefits by visiting americanpublicsquare.org. Thank you to everyone who joined today's discussion or provided a question. This conversation will continue in the coming months, and we hope you'll learn from this conversation and feel more empowered to engage in your community as a result. Have a wonderful afternoon.